In the end, I knew this was the only option for Peter, and we were going to get through to be able to enjoy life as much as we can. And never be afraid to ask always questions. You have to be an advocate for yourself and also who's ever going through the CAR-T.
My name's Peter David. I'm a multiple myeloma patient and was diagnosed in 2009. It's been a long journey, quite a few years with just a maintenance drug, and live what I considered a semi-normal life at the time. I was able to participate in a lot of activities, could still work. I relapsed, and eventually in 2022, I ended up getting a CAR-T.
As of 2024, CAR-T therapy is now available as early as second-line therapy. But that doesn't mean that it's appropriate. What it does mean is that a patient needs to have an understanding of all of their options. The idea of a therapy that would be completed and leave him with the opportunity to have sort of a treatment-free window thereafter was very attractive for Peter, as it is for many patients.
They're always thinking of what's next. If this treatment fails, I may not have additional options left. So when CAR-T came out, that was a big game changer. And with ever-changing guideline, it always helps us to stay connected with Cellular Therapy Center. So engaging with them early on in the course of the patient treatment also helps us understand where all this complex treatment fit to get the best long-term progression-free survival.
Things like this aren't easy to accept. I always encourage people to get second opinions. You got to have faith in your decision.
We always ask our patients that, hey, I want you to be comfortable with your treatment decision. There are so many treatment options that you can pick from. One size doesn't fit all. We can connect you with one of the leading experts in the field so that we all work together to come up with a plan.
You are going to have doubts, but this is what you need to do. You have to have that mindset, and you have to have hope that it will work.
Their biggest concern always is caregiver support, how much time they're going to spend in Boston, how soon can I see them back, what are the long-term complications that they're going to face, what additional support, which includes potential financial support or grant support for travel and everything.
And then Dana-Farber was very generous with lodging at discounted rates, food credits and gasoline credits.
At work, I was able to get FMLA for 12 weeks, so my schedule could be flexible. Not many people have that option, but right now I only work part-time, so I can help Peter.
But there's always mental turmoil too, and that's where the social worker and the support groups are very helpful. Anybody going through this, they're going to tell you you get anxiety, and he'll bring you back to a more level-headed place.
There are two separate sets of education here, right? One is the medical piece, but sometimes the burning questions that the patients and family have is, how are we going to do this logistically? Like, how are we going to drive there? How are we going to stay there?
The needs and the demands on a caregiver for a cellular therapy are quite intense. And going back and forth to the hospital or the clinic on a very, very frequent basis, watching your loved one go through this and being as vigilant as possible, monitoring and assessing them for toxicities. And then when those toxicities inevitably occur, walking through that with your loved one.
I had very good support in the medical field. If I saw something that was not right with Peter, I could just call them and they would get back to me right away. I would advise a caregiver to seek help, to join a group so you can communicate with one another and express what you're going through. At Dana-Farber at that time, I think that was the most challenging because we were in isolation. And then also when we were back at the hotel, I was not able to leave Peter. So you are committed. You have to stay with him just to make sure that he was okay.
It's very important that we build constructive alliances and collaborations across the CAR-T treatment centers and referring centers to ensure that all of this is very tightly integrated and coordinated. The treatment pre-CAR-T needs to be integrated. And then the treatment, the CAR-T monitoring and supportive care. I think respect is crucial. Understanding the common interests that we have in the patient's well-being and regular communication, not just about, what this is going to look like, but when issues come up, ensuring that our teams are really robustly staffed so that we know that we can reach each other in real time if necessary.
It's not one doctor at Dana-Farber say, oh, this is what we're going to do. It's a team effort. They want what's best for Peter.
Having this actual treatment available has changed how we treat myeloma, and it's not the last treatment, and we will continue to see more and more advancement in this field where we are going to sway away from chemotherapy altogether and may have a potential functional cure for the long term.